Yes, with reservations and just noting that a member of the community that I really respect is very concerned about this bill because of the vaccinations and lack of patient autonomy. Having not been able to do a lot of research yet that she's given me, I'm just going to be voting with reservations for now. Thank you.
Thank you, Representative. Representative Thielen?
Thank you.
Report number 830.
Same measure, Standing Committee Report 830 about vaccinations. Mr. Speaker, I also have concerns about the measure. I've been around long enough to see that what is...
Representative Thielen, I think you're standing with reservations?
Reservations.
Okay, thank you.
I've been around long enough to see that what is said is absolute in the health field later can change, and that no longer is the standard and as things move forward. So the thing I'm concerned about is it's a very scary thing for new parents to end up having shots given to their little babies, and some of the babies have quite a violent reaction to that. I would hope that everything is being done with the best medical science that's available, but that best medical science as of 30 years ago, 40 years ago, 50 years ago, no longer is the same as today, and is today safe enough for what may be the standard in another 20 or 30 or 40 years. I'm just concerned about that whole area, and so I'm not voting against it because I don't want the bubonic plague to come back. We've almost eradicated polio, and so yes, vaccinations are necessary, but there's also a word of caution to go with them. Thank you.
Thank you, Representative. Representative Ward.
Speaker, I rise with reservations.
Please proceed.
Speaker, my reservations are, I guess I should inoculate myself and not sound like it's anti-health, but what we have is a growing steep climb in autism. We have military veterans coming back, and I was speaking to a researcher from mainland China recently, and they said each time you get a immunization, you're getting a dose of toxicity. But if you're a baby and you get 5, 10, 15 of these per day, you're mixing different toxins together. And if you're in the military, as one of my colleagues said, when you're being stationed, you walk down a line and you get shot in the arm continually. My point is, if this bill is going to set guidelines, let's let the volume in one day or the volume in one period of time be established, because I think what China or this particular individual is mentioning is of serious concern. We cannot explain autism. Even though there's some explanations theoretically, we don't have the data, but it's very commonsensical to have too many toxins in too much of a system to override the immune system, and then you come up with all kinds of different things. So, Mr. Speaker, I think this needs further discussion. It's a very serious issue, and I'm hoping that we'll proceed prudently. Thank you.